Hello, and in this video, we're going to apply and demonstrate person-centered therapy principles, as well as a variety of therapeutic communication skills to counsel a young patient who has recently received a cancer diagnosis from their doctor. In this situation, a 19-year-old recently got diagnosed with cancer from their doctor. The patient will now be meeting with an oncology nurse with their mother. The patient is very anxious and wants to know what they can do to prolong their life and deal with the cancer. The mother is just as concerned and also wants to know how to take care of her son. This topic is important to discuss as nursing students because delivering compassionate and effective counseling to patients facing life-altering diagnoses is key to holistic care. Nurses help these patients process overwhelming emotions, fears, and uncertainties which this patient might be feeling in the situation. Through person-centered therapy, nurses can build trust, offer emotional support, and guide them to make difficult decisions. Addressing emotional and psychological aspects of illness, as well as physical, is essential for improving patient outcomes, enhancing resilience, and maintaining a sense of hope during these difficult times. So after some research, we determined that person-centered therapy is the most appropriate in this situation because of its focus on empathy, unconditional positive regard, and acceptance. This therapeutic approach is rooted in the belief that individuals already have the ability to self-heal and work towards personal growth, and seeks to create a therapeutic relationship between the counselor and the patient while the patient feels understood, validated, and supported while navigating their thoughts and feelings surrounding their diagnosis. For a young patient who has just received a life-altering diagnosis, creating a safe and non-judgmental environment will be essential in facilitating emotional resilience and empowerment, which is exactly what following a person-centered therapy approach will provide. We will now demonstrate this in practice.
Hello there, my name is Casey Castillo, one of the nurses on oncology building. I understand that you two have heard some difficulty news today. How are you feeling today?
I guess I don't know. I don't know what I'm feeling. Kind of lost, confused, maybe.
Let's see. I understand that it's going to be difficult for you. Just want to let you know that I'm going to be here for you from the beginning to the end. As your mom as well. It's normal to have those concerns and feelings that you have right now, okay? Do you have any specifics that you are wanting to understand today or any concerns that you might have?
I guess so, like, I don't know how this medication is going to affect me. I've seen every time in those TV shows when someone has cancer, they start losing their hair. Like, I'm going to be like the new Walter White. Is everyone going to be saying that? Like, am I going to be Mr. Clean? I might as well shave my eyebrows off too, just so I can represent him. Maybe I should start doing meth. Be the new Walter White. Like, am I just going to be in bed all day? Am I going to be using a wheelchair from now on? I don't know what's going on. And I wish like it was explained better to me. I just want to know more.
Those are valid concerns that you have there, Lawrence. I understand that, like you said, your hair might start to fall off. You might be put on some medications. You could start to feel more pain. And if you don't mind me asking, why do you put yourself in that negative positions? Why do you talk to yourself like that? We do have some friends or family that can support you throughout. Your mom is here right now that's supporting you throughout this process.
Well, I mean, I guess she is. It's just like I'm going to be the only 19-year-old that's going to have cancer around me, and people are going to start treating me differently. Like, that I won't be able to do this, like they're going to start babying me. I want it to still be me. And I don't want people to start calling me names. I've been bullied very early on. And it's so easy to see like the negative view of this because cancer is not something good to look at. And like, what's the positives that can come out of treatment?
Well, I think that's something that we should discuss further, is the positives of what can come out of treatment. Instead of just focusing on the negatives, maybe the nurse can talk to you about that.
Okay, I'll give it a try.
That's really good of you, Mom. You're there to support your son. It's always good to have a family's life support with you. Let's take this one step at a time, okay? Well, we're not just gonna talk about what you just said. About, is there anything that you've been doing before that you want to keep maintaining throughout your process?
I mean, I guess I've been keeping contact with some friends. Sounds like they're messaging me right now. Like, I've been playing a lot of games with them recently, so they might want me to play right now. I've been going to the gym a lot lately too. So I keep like some healthy choices open.
That's
And
good to hear.
yeah, me and Mom plan on traveling to Athens to see what's going on over there. So I guess there's that.
And it's good to know that. So we'll incorporate that with your journey throughout your process that you're going to be going through. We'll give you some time to have some games with your friends, and we'll also maintain the schedule that we have for you so we can actually provide you the best care we can.
And I think it's important that you know that you don't have to quit everything because you're in treatment now, that you can still do things, but in moderation.
Oh.
You don't
So-
have to give up who you are because you have treatment going on.
So it doesn't mean I'm just going to be dying. There's ways for treatment for this.
Yes, there are some chances for you. There's some process that you can go through right now. Some chemotherapy that you'll be introduced to by your doctor, and I'll be there with you every step of the way. I can set an appointment for you too, so it's gonna be an easier process of transaction between you and the doctor. I'll let him know the things that we've talked today, so he's fully prepared to incorporate the things that we want to add on your journey.
Yeah, because the doctor came in and kind of told us the results, but then he's very busy, so we'd like to have a better conversation.
We will make sure to make some time for you, okay? So you know that we are here and we're not just passing by.
Okay.
Yeah, and I think it will be important to talk with him and get a better sense of what's gonna happen, and also have other support systems here, like.
I think there will be some additional support that will be provided for you. They could introduce you to a group of same age as you who might be experiencing the same cancer or in that area, who could relate to you and maybe join you in your on your playtime as well with your friends.
Okay. I guess I might not be the only one. It'd be nice to hear how others are processing through, so I can see how I can process this through too.
Do you have any questions or concerns for me at the moment? Anything else that I can provide for you?
Well, I think just setting up the meeting with the doctor would be great to have, and then making a time for all of us to work and get together again to collaborate on a plan.
Before you guys go, I understand that you have some coping skills already with you in your mind, which was playing video games. Do you have any other coping skills that you might have that could help you through this journey?
Unless showering counts and having my thoughts by myself, then I don't know any good coping skills to help at all.
Yeah, those are some good ones, but I can recommend you some as well that you could try.
Okay.
There's one that you could do some journaling. You can do this before you go to sleep, or
That even help.
yeah, it's just a good way to release some pent-up emotions that you have, just like unburden some heavy liftings that you might have in your head or your body. Just a good way to release off some bad steam.
Okay. Yeah. I might give it a try.
That's good.
I think it's more effective to throw it down on paper than to be
Yeah.
destructive with your feelings.
It's,
It's a good coping skill to have.
I'll give it a try then.
it's good. Yeah, and of course, you don't have to stop doing what you've already been previously doing. You don't have to change anything that you have going on right now. Everything's still gonna be the same for you. It's just gonna be some additional support and system that might be implemented on you.
Okay,
Okay.
that sounds good.
And what about you, Mom? Is there any coping skills that you might need to
Well,
incorporate?
I think it's important to keep talking to people, like having that counseling group that you mentioned and still talking to friends, family. I think it's important to keep doing that and not just hide away your feelings.
That's good. And so you are well aware of what you have in mind then?
I think so.
That's good. Well, it was nice to meet both of you today, and I hope everything goes well moving forward.
Yeah, thank you for your time.
Thanks for clarifying everything. That really helped me out.
That's good. Nice to meet you.
As well.
It helped me clear my mind up a little better. And thank you for that. You helped me understand that I'm not just going to die, that this is going to be a journey. And that it's going to be a long process, but I hope I'll get there. Thank you for that, nurse.
No.
We're just talking about what kind of communication skills that we use and what we will be using forward into our nursing practice. Who wants to start us off?
I guess we kind of used a little bit of like empathy there, right? No feeling. It's not like we understand the situation, but it's knowing that
We're there for them.
that we're there for them,
Yeah.
right? And like providing that support and like,
Another good one that we kind of used was silent listening. I know that part was very awkward recording it, since silence is a bit awkward to some people, but then it's kind of necessary for other people since it leads that time for them to like gather some thoughts for themselves and just to fully understand what they're experiencing.
And not rushing them and letting them think through their feelings, and I think that's important than trying to make it seem like you have an agenda to complete.
and I feel like we're going to be carrying that on as we go on, just because there will be a lot of times when some people are not comfortable talking about a certain topic, right? So we might have to wait there for how long and until they're comfortable.
Yeah.
So I think that's something I would take on and use it further in my nursing career.
Yeah, definitely. I think giving that space in between patient interactions and like giving space for them to think will also contribute to like the person-centered therapy principles, where unconditional positive regard and like all that kind of stuff.
Because in that scenario, it was so very negative. Like the character I was portraying, like very negative. Because of course it's cancer. There's nothing good that can come out of it, and they were very uninformed of anything. So it's good to give unconditional positive regard for that, and like providing the correct information too.
Another thing that I noticed too was how the nurse, like Casey, was being an advocate for his patient. So the patient and his mom both expressed not having a lot of information about chemotherapy, and then him offering to speak with the doctor and make a meeting that would work for them. I think that's important too.
So I guess being flexible too with your patient is a really good one.
Especially with the part where the patient was joking around, and on my part I kind of have to see that as a good way as well, since it's part of his coping skills that he might be using for himself. And you were talking about Eve a while ago, how about teenagers are, you're needing to set them in the right path now for what proper coping skills that they may have.
Yeah, just so that they don't turn to any bad habits, because teens are more susceptible to do that if they can't cope effectively. So.
Yeah. So during that meeting, I'm glad the mom actually came alongside with that too, just so like the mom can hopefully keep the teen like on the right track, because like you said, they are very susceptible to like negative things and they can go downward spiral.
Yeah, and I think overall what we learned is it's very important to keep in mind who our client is and what level we have to go to reach them. And each client is going to be different. They're going to be facing different situations and different challenges. So when we take an on approach to therapies, we have to be conscious that not all therapies will fit that client, and we need to select the most appropriate one and need to tailor it accordingly.
Another important one too is to be an equal to your patients, not treating them like you're the authority, you're not the expert, but just to get onto their level, understand what they're thinking, and to know that their feelings are valid and that you're not just there to fix them, but to listen to them.
So I guess what's something that we kind of want to use forward in our nursing careers?
I was going to say about the treating the patient as an equal to. I guess that's something I would take forward to.
Yeah, and for me, it's using unconditional positive regard in all situations.
I kind of said that earlier.
With the silent listening.
Yeah, using silent listening because it takes a while for the patient to open up.
Yeah, I do agree with that one as well. That's one of the hardest things to do, is sit silently with your patient and just being there for them on that awkward silence.
Yeah.
Yeah.
And so kind of same as well.
Yes.
Okay.
Alright, I think that concludes our video project.
Thanks for watching.
Thanks for watching.